Okay, so we'll start this morning's presentation.
Morning, everyone.
Some introductions to start with. My name is Les Jones. I'm a business development manager with CareFlex. With me today is my colleague Rebecca Dunstall,
Hi.
our clinical lead. Just working away in the background as well, we've got Jess and Kim. They'll deal with any kind of technical issues that you may have. If you want to use the chat feature to report any issues, hopefully you can hear us and see us. The format of this session this morning is a little bit of PowerPoint with Rebecca. Then we'll move on to the chairs to look at how specialist seating assists with pressure care, stop the pressure. If you've got any questions, there is a 15-minute session, question and answer session at the end. Anything we don't get round to answering, we will come back to you with email responses as well. But if you want to use the chat feature in the meantime, we'll try and pick up the questions towards the end. So we're just going to start now then with the
I'll share the screen.
The screen. Rebecca's going to share the screen just to see. You'll get a copy of the presentation as well. The session this morning is approximately an hour, 45 minutes, with a 15-minute question and answer session at the end. So I'm just going to pass you over to Rebecca, and I'll see you in a few minutes.
Thank you, Les. Hopefully everyone now can see that as a full screen. Any issues, as Les said, if you just pop in the chat and Kim or Jess will be happy to help. Hopefully that's loaded okay. So as Les said, the focus of the session is to relate posture and specialist seating to pressure care. My name is Rebecca Dunstall. I'm clinical specialist at CareFlex. I'm a physiotherapist by background, and I was fortunate when I graduated that I specialised straight away into learning disabilities and neurology. So postural management has been a key objective of mine with individuals that I work with throughout my clinical practice, and that's where my passion for specialist seating comes from. Now, as it is Stop the Pressure Week this week, we wanted to do our part in raising awareness of the importance of postural care and its ability to support individuals holistically. And we want to do that by highlighting the positive impact that posture can have on pressure care. So we're not here to teach you about the ins and outs of pressure care, because of course we are the experts on specialist seating. So we just really wanted to highlight that we can't get that good pressure care without first achieving good posture. At the end, I will provide you with, there are some good links out there, things like the Love Great Skin campaign, if you do want more information to read around the key parts then of pressure care itself. Sorry, it's taking a while to load. Hopefully, okay, we've got it loaded now, brilliant. Okay, so posture and pressure are inextricably linked. Body posture and the way that we position ourselves will have a direct influence on the pressure going through specific body sites. And there are, of course, body sites that are at an increased risk of developing pressure ulcers or pressure injuries, generally bony prominences with little fat coverage, not always. But if you do work with individuals who present with postural challenges, then you might need to consider specifically some of these key areas, things like the back of the head, the scapula, the elbows. Maybe if somebody has a lean at the trunk or reduced posture control, maybe they put increased pressure through the elbows. The sacrum, individuals who maybe have pelvic instability going into a posterior pelvic tilt, and you've got that increased pressure over the sacrum. Even things like the back of the knees. So something as simple, and we'll cover it a bit later with Les when we have a look at the seating solutions, but something as simple as the basic chair dimensions. If we don't get seat depth correct, for example, then regardless of whether our individual presents with any postural challenges, regardless of whether they have any damage to their body systems, if that seat depth is too long for them, then we could be then increasing pressure at the back of the knees and increasing the risk of pressure ulcer there. And of course the heels, we'll cover this again a bit later, but please don't forget about the feet. Even though they are generally considered a weight-bearing dynamic body segment, when it comes to sitting, they actually play a vital role in that stability and with pressure management as well. Now, when an individual is in sitting, pressure is exerted through their skin onto the soft tissues beneath. If they aren't supported appropriately, if they're not in an upright, stable position, or if they cannot reposition themselves, then that pressure can result in poor blood flow, causing direct damage to the cells. The body can only withstand those high interface pressures for very short periods of time. So when the loading of tissues is unequal or that pressure isn't regularly relieved, then that's when pressure ulcers can develop. Damage to the tissues can also result from friction and or shear forces. For example, when an individual slumps in a chair, and that can be seen in individuals who might have reduced postural control, pelvic instability, or generalized weakness. I mentioned shear and friction forces. I just wanted to differentiate the both and just give you an idea then of how that can relate to seating before we look at the seating solutions a bit later. So if you imagine you are at the top of a slide and you have the skin in contact with the slide and you're trying to go down the slide, but the skin is stuck to the surface, that's the shear. So you can feel the skin stuck to the surface and we can't move down the slide. So that part of the body tries to move, but the surface of the skin remains fixed. Now, when we start going down the slide, and you can feel the skin rubbing against the slide, that would be the friction. So when that shearing force increases sufficiently to overcome that body's segment's resistance and movement, then that would be the friction. Now, this is really key in seating because, of course, there are different functions on the chairs that work incredibly well for posture and pressure care. But there's also the risk of inappropriate use as well. So when we talk about related things like back angle recline and tilt in space, they have to be safe and appropriate for the individual user, because if they use it inappropriately, they can actually increase this shear and friction forces. And that'll make a bit more sense when we talk through the seating solutions. But I just wanted to cover the theory aspect there. I also wanted to mention about moisture, because this can be a key part when we're thinking holistically about the individual within the chair and within the environment as well. But skin should not be left wet or moist, as it can become macerated. So when you get that like prune-like fingers when you maybe been in the bath too long, because when that happens, it actually makes the skin more susceptible to those shear and friction forces. So things like choosing the right materials and fabrics in the chair and using the chair within a comfortable environment, thinking about the individual's body temperature regulation, the continence and things like that. But we'll talk about the fabrics and things later, won't we, Les?
Yeah, we'll cover that in a bit more detail.
Brilliant. Now, even if an individual is able to achieve this gold standard 90-90-90 sitting position, so the pelvis is in a slight anterior tilt, the hips and knees and ankles are all at a 90-degree angle, which in real life isn't realistic. It's not something that even individuals without any damage to the body systems tend to do throughout the day. But even in that gold standard sitting position, body weight is distributed with 75% through the buttocks and thighs, 19% through the feet. This is why I mentioned the feet and how they're a key part of posture and pressure care. 19% of the body weight goes through the feet, even in sitting, 2% through the arms of the chair, and then 4% through the back. Now, if we put this into practice and consider a gentleman, a 32-year-old gentleman with cerebral palsy who presents with hypertonicity, so he's got increased muscle tone, a kyphoscoliosis, and a pelvic obliquity. Now, if his postural needs aren't met, it could result in 96% of his body weight concentrated on one part of his pelvis, with that potential for significantly high interface pressures over one ischial tuberosity. Now, we simply cannot ignore the impact that appropriate postural care can have on this individual's pressure care, especially the soft tissues beneath and even the bone. So pressure injuries can develop in individuals who maybe have difficulty managing their posture, who are unable to reposition themselves independently, or maybe they present with reduced sensation. But with the correct holistic approach, this shouldn't be inevitable. The impact of a pressure ulcer on individuals can be significant. So it could affect them physically, psychologically, socially, emotionally, spiritually, and even financially. and it can have a profound effect on their overall well-being due to the pain and the debilitating nature of a pressure ulcer. Pressure injuries, this is quite a shocking statistic as well, in older persons are associated with a 5-fold increase in mortality. And it can also result in longer lengths of stay in hospital, which can obviously have a major impact on the health outcomes. One study showed that adult patients who developed pressure injuries had an extended stay of over 4 days in hospital. The quality of life is understandably reduced in those experiencing pressure ulcers, and no person's ability to live a fulfilling life should be impacted by a mostly preventable cause. Appropriate management, or better still, prevention, will ultimately improve their quality of life. And a key intervention for this is pressure redistribution through a regular repositioning or a regular change of position, because it's believed to be one of the most effective methods for preventing skin damage. There are nice guidelines out there that states that adults who have been assessed as being at risk of developing a pressure ulcer should be encouraged to change their position frequently and at least every 6 hours. Those at high risk of developing a pressure ulcer, it then goes down to a change in position every 4 hours. Now, the NHS as well have stated as well that moving regularly and changing your position helps to relieve the pressure on ulcers that have already developed. So it can also help in preventing, but also being reactive and managing those pressures too. And for some people, this change in position may be needed as often as once every 15 minutes. So again, we can only give you kind of the guidelines that are out there, suggestions, and it is going to be on a completely individualized basis. And we aren't here today to talk about the ins and outs of pressure care, as I mentioned. So I really just wanted to focus on how seating can play a key part in that pressure care. And a repositioning, when we're using specialist equipment like specialist chairs, things we need to think about are whether that individual is able to change their position independently, whether they need prompting, so maybe there are cognitive implications and they need reminding or prompting to change position, or maybe they need full support, maybe they're physically unable to change their position and they need hoisting, for example, to get that regular change of position. And this would all become part of that individual specialist seating care plan. We have got lots of it, Les will probably talk about this a bit later, but we have got lots of information on the website, lots of how-to guides and videos on the chairs, clinical justification documents. We've also got things like the pocketbook available. Yeah, it's a great resource really to refer to back up what we're talking about this morning. Yeah, so if there's anything that I'm saying, because I realise the 45 minutes isn't a long time to cover such a complex topic. So if there's anything that I am mentioning, either get in touch with us, pop it on the chat, and if there is any links that you need or any more information about any of these things, then we can share that with you, especially things like care plans. And I don't want to get sidetracked here because obviously we're passionate about seating, but when it comes to seating, the chair is only good as how it's used. Yeah, the devil's in the detail, and we'll look at some of the detail on chair setup and how it'll affect pressure care and pressure care management in a few minutes. Especially if we're working with individuals with complex presentations, those at risk of postural deterioration, those at risk of pressure ulcers. That care plan, once we prescribe and set up that chair, and obviously as clinicians we can't be there 24 hours every day, and when we leave that setting we need to make sure that that chair is being used consistently, safely, appropriately, and that everyone involved is compliant with this. That care plan is a really key part of that, to make sure that not only is it continued to be used, but those involved, the support network, the individual, know how to spot any or identify any risks or any changes to their needs, so that they can refer back or get a review to make sure that that piece of equipment remains suitable for them. I digress anyway. You do. So when it comes to pressure care, then within postural management, there are some intrinsic and extrinsic factors to be aware of, especially when we're doing, so we talk about our seating assessment, which you would do with the likes of Les and the other seating assessors within the CareFlex team. But there's also what we call a pre-assessment. I think, Les, you like to refer to it as, or it would be the clinician doing their postural assessment, their pressure care assessment before that seating assessment takes place.
It's part of a team approach, really. You will provide us with the detail on the client and what the what the goals are for the assessment, and we will suggest possible solutions from our range of products to help with that. So it's very much a team effort, and you can't really give us too much information before the assessment. The more information you give us, the better, especially when we look at what we like to term as a holistic seating assessment as well.
Definitely. So this is, of course, related to pressure care. We have done webinars in the past where we've covered the hints and tips on assessment. When we do our training events, we share some of those kind of pro formas then for what kind of information would be needed by the seating assessors before we do that seating assessment. So I wanted to focus on the pressure care aspect and some of the things to be mindful of before coming to that seating assessment. So there's the intrinsic factors, which are related obviously to the individual, things like their diagnostic testing, their diagnosis, whether treatment and management plans are followed, medication is administered as prescribed, considering their nutritional status, their continence, and of course the physical considerations, their body systems, their body structure. We need to be mindful of those things, not only if we need to signpost to other professionals, to other experts for a holistic approach, as Les mentioned, but also to know exactly how we need the specialist chair to meet some of those objectives. So, for example, if somebody does have issues with continence, do we need to consider different kinds of fabrics or materials that are maybe breathable, that does allow for airflow, that is, in terms of infection and prevention and control, meets those objectives. But then there's also the extrinsic factors, and that's really how then specialist seating can shine within pressure care and postural management. So choosing appropriate equipment and including the chairs and functions. So I mentioned about tilt and spacer, back angle, recline, we'll cover that shortly, but making sure not only we're choosing the right chair, but the right functions and accessories for that individual. There is such a thing as over-prescribing. We want to make that chair as simple to use.
That's one of the goals of an assessment, is to provide the most simple solution to the postural need, but bearing in mind we need to future-proof things as well. So there's a balance, and the word we use a lot of here in seating is compromise.
Yeah. We obviously want to make sure that I said about the fabrics and materials, but then we need that chair to be able to support repositioning throughout the full 24 hours if needed, whilst also considering all the other equipment the individual might be using and thinking holistically about that 24-hour management plan. But then also how that chair fits within the environment for the individual. Does the individual need to manoeuvre between rooms within the house for different activities or different well-being goals? Do we need to think about the temperature if they have regulation concerns? Do we need to think about where it's located? I know that Les has worked with an individual where the environment and the positioning of other functions within the room was actually a key part of. Yeah,
the key part of the assessment was the position of the TV, because that was this gentleman's kind of main activity. It took us a couple of months to work out, but we needed to mount the TV on the wall. It wasn't something that we did, but we suggested that, and that did help things, immeasurably, once we realised that was the key part of the assessment, if you like, for the user.
Yeah. And that will obviously then come into the pressure care side of things as well, to make sure that as part of their care plan, that the support network knows that they might need to think about the temperature of the environment and so on. But also enabling, when I talk about the environment as well, and all the other equipment, it's enabling a change of position as well. Do we need to look at transfer methods in and out of the chair and how that works with other equipment to make sure that we are achieving that regular change of position? Now, the use of an appropriate support service is key to preventing and managing pressure ulcers, as well as increasing patient comfort. Again, we've done full webinars just talking about comfort, so it feels a bit strange to just skip over something as important as comfort, because it is a key objective for us at CareFlex.
But just to say, we can, if anybody's interested in any particular subject we've covered in the past, we can always supply you with a copy of that seminar as well.
Yeah, brilliant. And specialist seating will aim to support this objective. And there's actually, if you need that justification as well for seating support services, especially in managing risk, posture and pressure risk with individuals, then there's a good practice statement that's available. That was an international collaboration that stated that a seating support surface that meets the individual's needs for pressure by addressing their body size, posture, mobility, and lifestyle should always be considered. And that's that true holistic approach. So that's a really good justification, a bit of evidence if you need it for your funding requests. Now, specialist seating systems aim to reduce the risk of pressure ulcers by distributing the user's body weight evenly throughout the chair over the maximum surface area. So that's the simplest definition of what specialist seating achieves within pressure care. We want as much of the clients, the users, the individual's body in contact with the chair. When we're talking about posture, we're either trying to correct or accommodate. So if you're able to correct an individual within the chair, then fantastic. But if we are unable to correct them and maybe their postural challenges are fixed, then we need to accommodate the chair around them and essentially filling in the gaps to try and get as much of that body in contact with the chair so that we are reducing those interface pressures and distributing it evenly throughout the chair. Now, that opportunity to sit out can offer a much needed regular change of position to encourage that much needed blood flow and oxygen and nutrients to the cells by redistributing that pressure. Now, before we go on to the practical side, just actually show you some of the seating solutions that can help to manage pressure whilst ultimately managing pressure risk. The million-dollar question, what exactly is good sitting posture? And this is a really good definition by Pope. Those of you who are interested in postural management will no doubt have heard of Pauline Pope. But this is a really good checklist when we're thinking about seating prescription. So the body is conformed to the supporting surface as symmetrically as possible. Obviously, these are gold standards, and we appreciate that we work with very complex presentations, but we still want to achieve that optimum sitting position for the individual. The body weight is distributed equally over the maximum surface area. The body is balanced and stabilized within the chair, but it can also adjust to change. So it can still be dynamic, reaching outside the base of support, engaging in activities while still maintaining that balance and stability within the chair. The body segments are supported and aligned as much as possible. Again, as Les mentioned, if anyone wants more detail on things like the body structure and body segments, then we can share that. But in terms of the body segments within seating, of course, the foundation for seating is the pelvis because it dictates what happens in the body segments above and below. But we need to make sure that we're addressing all those body segments within the chair, even the feet and the arms. And then we also want to make sure that the upper limbs are free from the load-bearing role for function. So the individual isn't using their arms then to support them within the chair. We need to look at the pelvis, look at the trunk to get that stability and trunk control first so that they're able to move the upper limbs to reach outside the base of support, to engage in activities that are important to them and not clinging on to the arms of the chair or digging the elbows into the corner of the chair. So it's about those key principles for seating, the comfort, the function, the postural management and the pressure care. Once we've got that optimum sitting position, we want to, as I've said, facilitate that functional performance. We want to make sure that the individual is energy efficient, so they're not fatiguing too quickly within the chair. And we want to make sure that whatever position that we're putting them in is not further harming the body systems. So they're not at risk of further postural deterioration or postural challenges or physiological function. Again, I think I'm going off on a tangent. Yeah, I am.
Rein you back in.
Yeah, rein me back in. But what we want to make sure is that obviously we've got that initial setup appropriate, but what's important with pressure care, and we say this all the time, it's not just about getting that one perfect posture, it's about thinking about that full 24 hours, getting a good posture that individuals are compliant with and consistent with, that we can change throughout the day to distribute pressure, but also remain active with our body segments. So we're protecting the body segments as well and protecting the body structure and getting blood flow to the area, preventing from injury and keeping dynamic and so on. So visually, just to have a think about what we mean by good sitting posture, you can see this lady, gravity is taking hold. I mean, gravity is unrelenting. It's even for me at the end of the day, and I'm sure for you, Les,
You're getting shorter.
Yeah, you get shorter. You can feel yourself, gravity takes hold, and it's really difficult even for us to maintain that rigid upright position against gravity. So if you're working with individuals who lack postural control, maybe have generalized weakness, gravity is a really difficult thing to maintain upright against. What you can see in this individual is gravity bringing her into this destructive posture and holding her there. We've got unequal loading of the tissues. So thinking about pressure care for this individual, we've got increased pressure going through one side of the pelvis, through one of the arms, through, you can see through the upper arm there. So increasing the interface pressures on that particular part of the body and increasing the risk of pressure ulcers developing. The head is rolling forward, so we've got that slump, that kyphotic posture as well. So thinking about physiological function as well, comfort for this individual, and all that holistic stuff that links into that. And essentially what we want to do is to get the individual as upright as possible, as symmetrical as possible. And I mentioned about full contact with the chair, so as much of that body in contact with the chair to distribute that pressure. Trunk and spine supported, the chest and shoulders opened up, the pelvis stable at the back of the chair, and of course the arms and feet fully supported as well. And of course this is the gold standard, and it's not going to be achievable in complex cases, but we should always be aiming for that individual's optimum sitting position. Now, I guess the take-home message for this webinar today, as I said, we're not the experts on tissue viability, and that's this is where kind of things like the Love Great Skin campaign comes in. This is produced by Wounds UK, and it raises the awareness of pressure ulcers, and they've got a really good pack with a number of tools. Those of you who know things of the Simple Care Plan and the skin target there. So there's a series of how-to guides that you can download. So really do check it out. I mean, obviously, this is a really complex topic, but what we want to focus on now is a take-home message that we cannot achieve good pressure care without considering an individual's posture. They are inextricably linked, and we have to manage that individual's postural challenges to be able to distribute weight evenly and reduce that risk of pressure ulcers or pressure injuries developing. So let's get the video. Hopefully everyone can see us now.
Okay, so what we thought we would do now is just to look at our chairs in a little bit more detail and use them to illustrate how specialist seating can assist with pressure care. I'm not going to go through every chair in depth. If you need a bit more information on the chairs, again, refer to the website. I'll give you some little tips on how to identify the chairs, and if you're reissuing products from a community loan store, for example, we can discuss that. So basically, our range starts with mild to medium to complex in terms of postural support. And what I'm going to do, I'm going to start at the foot of our potential chair user and explain how different features and accessories and the way that the chair moves can affect the level of pressure care that we can provide.
It's probably worth noting here as well that we're obviously talking about postural needs here in terms of mild to moderate to complex. Just be mindful that somebody's postural presentation doesn't dictate their pressure risk. So somebody who has complex presentations isn't necessarily more at risk. Of course, there are going to be external factors, but in the more simplest terms, somebody who doesn't have complex postural presentations is still going to be at risk of pressure injuries or pressure ulcers, because when it comes to postural management and pressure care, even if somebody is in a fantastic gold standard sitting position, if they maintain that position for prolonged periods of time without getting blood flow, without getting a change of position, they are going to be at risk of pressure ulcers developing. If I sat down in one position today, if I stayed in this spot for the next 10 hours, I will know about it by the end of the day. So don't be fooled by somebody's postural presentation with regards to their pressure risk. We just need to have the same objectives with everyone. We need to manage their posture as best possible, and making sure that we're getting that regular change of position throughout the day to reduce those interface pressures and get blood flow to the area. When it comes to seating solutions as well, I mentioned about this, the postural assessment and the seating assessment. They do have to be totally individualized, and that's why we can't be too specific with some of these seating solutions, because it does have to be a full, comprehensive, holistic assessment by skilled and experienced professionals, to make sure that the prescription is safe and appropriate, but then also the setup is for the individual.
I think I'll explain a little bit more about this, but the devil is in the details. So really having an understanding of how the chair works and moves will impact on the level of support and care that we can provide. And comfort is something that we very key. It's very key to us at CareFlex is to consider the comfort of the client as well. Yeah,
I mean, if somebody's not comfortable in the chair, regardless of the clinical benefits that we try and put across, if the individual isn't comfortable within the chair, they're simply not going to use it.
Right, so let's look at the chair. The chair I've got here with me at the moment is the Smart Seat Pro. It's a tilt and space chair with back angle recline, adjustable seat depth and width. We'll look at those in a bit more detail in a second, and we'll discuss how these can impact on pressure care. But I'm going to start with the foot and the leg. You'll see we've got an elevating leg rest, little lever on the side here. To elevate. Every chair with me today is a manual chair, but we do powered versions of the chair as well. So what I want you to consider here to start with is the way that this leg rest works. If you look at this section here, and I'm not sure if we can zoom in on this.
Let me just
stop.
There we go.
There we go. So as I elevate the leg rest, you'll see that it articulates, it extends. Okay. That's really, really important, especially when we use a foot plate with a chair. What's happening is we're making sure that we're getting as much of the person sitting in the chair in contact with the chair through that leg elevation movement.
Because there's different pivot points for the leg rest and obviously the knee. If we don't have that extension, then what you'll find is the individual will suddenly there'll be a gap behind the knee, and you'll see the thighs lifted away from the seat cushion. So obviously then we're increasing the pressure at the ITs, at the ischial tuberosities, or at the sacrum and the heels.
So that's key. That's a very important feature on any chair. But when we add the foot plate, because as Rebecca said a little bit earlier, a lot of our weight goes through our feet, even when sitting. So I just click the foot plate out. My client's feet are now on the foot plate. If this section here didn't articulate, it didn't move away, it would have the effect of raising my client's legs off the seat surface. So imagine, what we always talk about is getting as much of the person in contact with the chair as possible. There's less of the person in contact with the chair if this section here doesn't articulate.
And going back to that 75% just go through the buttocks and thighs, that could then be concentrated on the ischial tuberosities or the sacrum.
Yeah. I mentioned the foot plate as well. We need to be aware of how this is set so that it's appropriate for the lower leg length of our client. There's a lot of detail I'm going through here very, very quickly, but as Rebecca said earlier, if you want to go to the website, look at the chair online. We've got a lot of how-to videos which explain how these features operate.
And clinical justifications as well. So if you need that that justification for any funding requests or for just the prescription process, for each chair, there's clinical justification that goes into detail about the functions, accessories.
So we've got angle adjustment because we may have an issue with plantar flexion. So we can angle adjust foot plate. It may be that we just can't get our client's feet flat on the foot plate. They may be rolling out or rolling in.
Maybe they've got some fixed deformities there in the ankles.
So one of the options we've got to accommodate that, I'm just going to improvise here, is a soft cushion. So that just accommodates, and it's a little bit of a compromise again, but that would allow the feet to be absorbed and to roll out or to roll in, that fixed posture.
So this goes back to the objective that I mentioned, that if we can't correct the individual within the chair, we need to somehow accommodate and build up the chair around them to get that weight distribution as even as possible.
So that's foot plate and leg rest. I'm now going to move up the chair. I'm going to look at seat width and seat depth, and I'll stay with the Smart Seat Pro to illustrate. Help you. Keep my foot plate off.
Now, anyone who's been on our training before will know that we, as Les said, the devil's in the detail. We are really pro getting that initial setup for the individual. Something like basic seat dimensions are often overlooked and actually should always be the starting point. If somebody's having issues with getting a good posture within the chair, have a look at those seat dimensions, look at the basic dimensions, seat width, seat depth, seat height, and armrest height to make sure it is appropriate for the individual.
So what I've done here is to deliberately set the chair up so it's a little bit too wide and a little bit too deep. And what's going to happen, I'm going to look to sit in the most energy efficient way.
Mm-hmm.
I'm probably going to do this.
We naturally seek that support. We naturally seek that proprioceptive feedback to get the stability that we need. So even if somebody's got a centimetre or a few centimetres hip width, seat width that's not needed, you'll start seeing that shuffling, that rotation within the chair to seek that feedback.
Just take the arm away, just for you to see what's happening on the side. The seat depth is too long for me. That just feels uncomfortable. I don't think you can probably see what's happening here, but I'm slumped in the chair. I'm rolling back. My back is beginning to ache a little bit.
And that's just so Les can flex his knees over the end of the cushion.
Yeah, because otherwise, I'm going to be hoisted into the chair. I'll start in this position.
Mm-hmm.
Gives you a better idea, and you can see I'm quite cramped here as well.
And this is why I mentioned Les doesn't have any damage to his body system, and yet something like the basic seat dimensions has created a postural challenge for Les that shouldn't be there. It's a really key initial setup, looking at the basic dimensions for the individual.
So, and that sacral sitting posture is perhaps the most common posture that we see. You go to any nursing home and you'll see groups of people, of residents in the lounge sitting in that sacral sitting position. So how can this chair help with that pelvic stability? So what we can do, we can adjust the seat width and the seat depth. And it's quite simple to do. Again, you'll find online on a website more detail on the how-to video on how we achieve this. So little tag, sorry, on the right and on the left. I just pull the tag out, allows me to move the arms in. Seat depth, just like your car seat, we've got a squeeze bar. Squeeze the two bars together. I drag the back, so I push the back away from me. That will decrease the seat depth and bring it towards me to increase seat depth. And just something as well, just to, I'm sure there's a lot of people out there who will be reissuing chairs from equipment services or looking to reuse a chair in between clients. The chair's a class 1 medical device. CareFlex chairs are all class 1 medical devices. As such, they come with a unique serial number. That's on this little silver label there, okay? Make a note of that number, give us a call, and we can give you the exact specification and capabilities of that chair. So that's just a little hot tip. I'm not going to dwell too long on that because I want to work on seat and on the seat cushion. So I think we've mentioned that all CareFlex chairs have pressure care as standard. I'm going to take the cushion off our HydroTilt chair. Tilted space chair, seat depth and seat width adjustment. I'm just going to talk a little bit about the seat cushion and the pressure care that we've used. We've used this for 25 years, which says a lot about it in its own.
Lots of resources again on the website, pressure mapping studies, medical device agency studies. There's some published stuff in the journal Tissue Viability as well on water cell technology. So if you need that, we can link justifications.
As a reference, yeah. So what we have with the cushion is a 4-way stretch, breathable fabric. See there, a memory foam and a high density foam, and together that's called reflections foam. And there are 3 water cells. You can cheer that, okay, but in the base of the chair. And that, again, like all pressure care products, we're looking to get as much of the person in contact with the surface as possible and help to redistribute pressure areas. So what happens is the bony prominence, which is normally your ITs, come into contact with the seat surface. The 4-way stretch does what it says on the tin and gives, allows the high pressure point to be absorbed into the seat surface. The memory foam reacts to body heat and conforms to the body shape, and the water cell displaces. So quite simply, high pressure point becomes absorbed, the surrounding surface rises and spreads the pressure over a greater area.
To reduce those high interface pressures, those peak pressures within the chair.
And that's rated medium to high. And as Rebecca did say, that we've got data online, keep saying online, on our website that will give you more detail on how it works and how we've arrived at a medium to high rating.
While you're on the hydrotilt there, it'd be good to show the grips. So when we're talking about pressure care, and I mentioned about repositioning and redistributing pressure, if somebody is able to relieve some of that pressure, if somebody is able to reposition themselves, and things like the hand grips could be a really key part, even though maybe, again, the upper limbs are considered a more functional role. They can be a really key part of posture management and pressure care to enable someone to just reposition and shuffle within the chair and to get blood flow to that area.
To more upward position to help with the stand.
Yeah, to keep them active.
So that's our pressure care system, water cell technology. But we do just look at my contour cushion, just bear with me. You see more and more clients, service users with perhaps an obliquity or a rotation. So we now start to work with more contoured seating. And you can see what we have here is a ramped, you see the front edge being ramped there, and a contour at the front edge, okay, to help again with that posture and marrying that pressure care in as well.
Tends to be more comfortable, less restrictive than things like pommels. Obviously, pommels have got a role to play with some individuals, but if you are able to guide the thighs into that alignment with something like a contour, it's definitely more comfortable.
Mm-hmm. And just to say as well, I mean, we've got a lot of confidence in our seat cushion, but we do accept that, you know, there may be a need to use a third-party cushion, a more contoured cushion, an alternating cushion. We can accommodate that cushion within our seating system, because as you can see, all the chairs are modular in design, so I can quite easily lift our cushion out. That's the key thing, is not to put another cushion on top of ours. To lift ours out, and you can pop your cushion in. What we would recommend, though, is the use of a docking cushion. A docking cushion is a square cushion with a cutout that will allow you to pop your cushion in. It'll hold the cushion in place. It'll avoid any gaps that there may be at the front, the side, or the back of the chair, of the seat surface.
Yeah.
And that's an example of a tailored solution as well. Everything you'll see with me today is virtually an off-the-shelf accessory. But as a manufacturer, we've got the capability of manufacturing tailored solutions, custom-made devices. So that's always worth bearing in mind. So
I think a key function when we're talking about pressure care and how it's linked to posture, and obviously one of those key preventative recommendations from the guidelines is repositioning and redistributing. I think one of the key functions, one of the amazing things a specialist seating can do is tilt and space.
Yeah, that's just tilt and space is exactly what I was going to mention now. Now this is our new chair called the multi-adjust tilt and space back angle recline. Seat width, seat depth, and arm height adjustment. So tilt in space, controlled at the rear of the chair, squeeze the lever on a manual chair, gives me 35 degrees of tilt.
Do you want to show the difference between tilt and space and back angle
Back
recline?
angle recline, yeah. Because this chair's got both. So there's your tilt and space.
So this doesn't affect the pelvis, then we can still maintain that pelvic stability because the hip angle remains the same throughout that movement, whereas back angle recline is different in that it opens up the hip angle.
And that's your back angle recline.
I don't want to go into much today because I know we're focusing on the pressure aspect, but just be mindful that tilt and space and back angle recline aren't safe or appropriate for all users. So you still need to do your comprehensive postural assessment to understand whether those are appropriate functions and safe functions for the individuals before prescribing them. But if they are fantastic for pressure care.
Yeah, yeah. And again, I think I said earlier on, with the solution, if you like, we try to keep things as simple as possible. So if somebody doesn't need back angle recline, I would suggest we go for the chair without the back angle recline.
Yeah.
If we look at the future proofing, yeah, we go for something with both, but perhaps with the ability to show you here to lock off back angle recline. That's a locked lever. Okay, or we could reposition the lever. So on the assessment and setup, it's adjust and set. You'd lock it or remove it so that in effect gives you a tilt and space chair.
Back angle recline can really negatively impact on pelvic stability, and then somebody could go into that posterior tilt, that sacral sit-in, just from something as simple as opening up the back angle. So just be mindful of that. But the thing with tilt and space when we're talking about pressure care is that we can change the user's centre of gravity. So therefore we're altering the points of pressure. And there's some good research out there again that shows that using tilt and space can provide muscle and skin perfusion at the ischial tuberosities, especially when using in combination with back angle recline if it's appropriate. So in terms of pressure care and having to justify it for individuals at risk of pressure injury is a really good function to consider as part of the care plan. There are things as well like the motorized actuation and auto tilt as well.
Yeah, well, all the chairs with me this morning are manual, but we can motorize the chairs as well. So that would give you or give our client control over tilt and space, leg rest elevation, and back angle recline. There's another feature called auto tilt or regulated motion. And what that is, you press a button on the handset and it will cycle the chair through its range of tilt and space. Not as quickly as I'm going there, okay, but very gradually moving that chair through its range of movement. So that's, if you like, bringing all the features together. So we've got the surface that the person sits on. You've got the adjusted seat width and seat depth, helping with pelvic stability, foot support and leg support. That brings me neatly to lateral support. The multi-adjust, a very modular chair, very easily adjustable. I've got a flat back here, so options that we could consider to help with keeping that client in a midline would be adjustable laterals. Open onto the chair. It can be moved up and down, in and out. Shapes and different sizes, but again, when we come back to pressure care, not all our clients react well to having this lateral just tucked in under the arm. If they're leaning really heavily, perhaps they're fixed.
Mm-hmm. And then be mindful of back angle recline as well, because they can impact on where the lateral support lies on the trunk. As
we open up back angle recline, it has the effect of raising the lateral, so you end up in that kind of position. So worth considering what form of lateral support we want to use. So that's an adjustable lateral.
And why this is important, keep wanting to bring it back to this take-home message that we want to get across, is that if we don't manage pelvic stability, if we don't manage trunk alignment and all those other body segments, that individual cannot have equal weight distribution, and in which case we're going to get high interface pressures and we're going to get an increased risk of pressure injury. So it's really key to target all those body segments because they are all interlinked with that person's pressure risk.
So the other consideration, and perhaps a bit of a compromise, may be to consider a contoured back. That's a shaped back, okay? Softer edges, a little bit more give, a little bit more comfortable, a little bit more accommodating. You can see how quickly you can swap that cushion over. Once you adjust. So that's a compromise there sometimes with comfort and posture, where our client doesn't really take too well to the fixed lateral. The soft contoured back will kind of prompt that position for the individual. Just something else to think of, and tying up the seat surface and the back. Some of our more complex clients may have a fixed obliquity, which presents itself by the client leaning. So we need to be really considerate then of how we bring in lateral support and tie that in with a seat surface. Do we accommodate the obliquity, or do we try to correct?
Yeah.
And that's a question for you guys. you tell me what's achievable with your service user, and I can suggest different solutions. We can build up one side of the seat cushion to correct, or drop one side to accommodate. We could use one adjustable lateral or different shaped laterals. It's a mix, and that's an example of how we work quite closely together to arrive at a solution for your service user. Head support. Chairs work in different ways. We have two types of head cushion. I'm conscious of time now. We have a soft cushion, pillow type cushions. For example, here's a soft shallow, or the contoured cushion, or we do foam block cushions. It's also a big area where we get more involved with custom-made solutions, because head support is critical for some of our clients.
Yeah, that comfort is so subjective, especially when it comes to head support, and also the functions, the visual field, the hearing ability, it all comes into that.
Yeah, so just coming back to the Pro very quickly. For example, on the full section multi-adjustable back, now I can really adjust the back.
And this could be key for individuals who maybe present with increased thoracic kyphosis. That tends to be associated with increased pressures over the apex of that curve in the thoracic region. And I find these quite a difficult postural challenge to seat when it becomes fixed in that kyphotic posture. So something like that kind of function, the articulating headdress, again, brings the chair to the individual and accommodates to the individual to try and take that pressure away from that apex of the spine and reduce the pressure to encompass the full back body segment. Yeah,
I guess one thing we didn't mention, and perhaps we need to look at briefly, and that's the use of straps and harnesses. Sometimes quite contentious, just bear with me.
We keep bringing it back to that pelvic stability, but with seating, as I've said, it is the foundation for sitting. And if somebody doesn't have that pelvic stability, that's where then we can see all hosts of problems, things like shear and the friction forces I mentioned, the sliding down the chair, unequal weight distribution. So we need to take it back to that pelvis, get that pelvic stability to manage, I keep going on about it, but to manage that person's pressure risk. And obviously we want to do least restrictive options first, but if we're going up to complexity, that's where things like belts and harnesses then might be needed with the risk assessment, of course.
And we just need to consider, we mentioned fabrics, just you'll see the chairs here all in this kind of dark grey, black inner surface to the chair, which is a four-way stretch breathable fabric. It helps wick away heat, and it gives people the benefit of the pressure care that's within the chair. It gives and stretches. But also to consider that when you're looking at straps and harnesses as well, because you can see the padded pelvic strap here comes with the neoprene pad. So if it is on the hip, on the pelvis there, you've got some padding to help prevent any pressure care issues. Chest harness as well. The fabric is neoprene, it stretches and gives. The edges are nice and soft, so there's no marking or damage caused just by the strap rubbing. I think we've covered.
Yeah, in the time. Yeah.
That really was
a whistle-stop tour
of what we can do in our world of specialist seating to help with pressure care.
Yeah, we just really wanted to get that message across that we just cannot get good pressure care. And I think things are changing. I think that awareness is gradually growing. It's not just a case anymore of putting a cushion on top of another cushion. We've got to manage somebody's pressure to get that equal distribution, to get the regular change of position, to manage their pressure.
Yeah, and that holistic approach as well, that there's so many considerations that will impact on the choice of seating and how that will affect pressure care as well.
Yeah, because we need to get the individual compliant with the piece of equipment. Yeah.
I don't know how we managed it, but we just about dead on time. Does anybody have any questions? I don't know if Kim or Jess have noted any questions for us to take.
I think I've caught everyone's questions. I've sent a couple of emails with the documents requested as well. So if we've missed anything, I'm sure I'll add it to the recording that I send out.
Yeah, and just to say, if there's a need there to see the chairs in more detail, let us know. We can either do a more kind of focused virtual session on product, or
client-specific stuff.
Client-specific, yeah, or COVID allows, we can come and visit you and you can get hands-on with the chairs and take bits off and sit in a chair and adjust the chair.
Yeah, there's only so much we can do in an hour, unfortunately. It's such a complex topic, but we just really wanted to take the opportunity this week, because it is Stop the Pressure Week, to just again raise that awareness on how important postural care is to this aspect of pressure care. Yeah. And also a point, we look forward to seeing everyone at the OT show.
Yeah, we're all geared up.
We're all geared up. Stand A30 at the front.
We're at the front. Come and see us.
Yeah.
Okay, I think if nobody's got any questions, that's great. Really nice to kind of catch up with you.
Yeah, thank you for joining us.
Thank you for joining us, taking some time out of your busy day. Yeah, thank you very much. I'll bring the session to an end. Thank you.
Thank you.
Bye-bye.
Bye.